Good morning, everyone. If you could please take your seats, we'd like to get started. We have a very dense program over the next 2 days. My name is Jose Zuniga. I'm president of the International Association of Providers of AIDS Care. And I'm very pleased to welcome you all to the City of London. First, I'd like to acknowledge so many friends and colleagues who are here with us from so many different countries. My dear friend, Mr. Michel Sidibe, Executive Director of the Joint United Nations Program on HIV/AIDS and Under-Secretary General of the United Nations, the Honorable Dr. Jean Kalolani, Minister of Health of Malawi, the Honorable Senator Sibongile Ndlela Simeleni, Minister of Health of Swaziland, Ambassador Deborah Birx, U.S. Global AIDS Coordinator, High Commissioner of Canada to the United Kingdom, Mr. Gordon Campbell, Lord Norman Fowler, Member of the House of Lords, and all protocols have now been observed. Distinguished colleagues, ladies and gentlemen, again, it gives me great pleasure to welcome you to London, to this third summit focused on leveraging antiretrovirals within the context of combination prevention to end AIDS. My sincere gratitude to our partners in this endeavor, UNAIDS, Public Health England, and the AIDS Healthcare Foundation, as well as our commercial supporters, Gilead Sciences and ViiV Healthcare. I'm also grateful to our distinguished faculty for joining us to share their invaluable insights, experiences, and expertise. I'm extremely appreciative of the effort each and every one of you from 37 countries have made to be with us here in London. And to those of you who are joining by live webcast from around the world, thank you for taking advantage of technology to connect to 2 days' worth of robust conversations about how we, as a global community, can end AIDS through solidarity, focused work, and unequivocal commitment. When IAPAC first hosted this summit here in London in 2012, the concept of leveraging antiretrovirals to curb AIDS-related morbidity and mortality was not universally agreed upon. In 3 short years, while there are still small pockets of resistance, our conversation is much more focused on how, not whether, we implement these life-saving biomedical interventions to reduce new HIV infections and end AIDS-related death. Yet while the science and our advocacy have allowed us to, in many respects, win the argument, there are persistent challenges we must address. Among these is the reality that we must optimize the HIV prevention and treatment continua so that people at risk for and those who are living with HIV/AIDS achieve the maximum benefit of the full range of interventions available to us today. We cannot accept, for example, 2.1 million new HIV infections annually, or that 22.9 million people lack access to antiretroviral therapy, and that among those who have access, so few are achieving the ultimate goal of HIV treatment, viral suppression. Moreover, our efforts will fail if we do not address the myriad barriers that inhibit the uptake of HIV testing, linkage to care, the initiation of ART, long-term engagement in care, and ultimately viral suppression. In many respects, and has been eloquently articulated by so many of our colleagues over the years, HIV-related stigma and discrimination, as well as efforts to criminalize HIV transmission, are as great an enemy to our communities as a human immunodeficiency virus itself. It's therefore with that backdrop set that I open this third summit. Our work can deliver an AIDS-free generation, and within that context, there must be a sense of urgency to achieve that long-held goal. The reality that inaction yields steep costs, including those we can measure in lives lost, should also force us to dig deep, 33 years into the HIV epidemic, to mobilize, engage, and push ahead with deliberate speed, agility, and focus, because to squander this opportunity would represent an abrogation of our moral responsibility to save lives. We can do this. We can make new HIV infections and AIDS-related deaths exceedingly rare, but we can only do so together. And it's why I'm so pleased to welcome all of you to London, those here physically and joining us via technology. I'm also pleased to introduce now the co-chairs of this year's summit, each living up to his responsibility to advance a global life-saving agenda in solidarity with colleagues around the world. Please welcome Dr. Kenneth Mayer of Harvard University and the Fenway Institute in Boston, and Dr. Julio Montaner of the British Columbia Center for Excellence in HIV/AIDS in Vancouver, British Columbia, Canada.
Good morning. Thank you, Julio. Secretary Sidibe, honorable ministers, and distinguished guests. Having seen the first person who I took care of with HIV almost 35 years ago now, it's really sobering to think that we're still grappling with this issue. But the reason why we think this annual conference is so important is that we do have the tools, as Julio said, to really have a substantial impact on the epidemic. I hope the next 2 days offer us an opportunity to have a report card to see what's happened over the past year, what are best practices, what are the new ways that we can think about how we can use this incredible tool that we have at our disposal, antiretroviral medication, to really curtail the epidemic. We will be hearing about best practices from different parts of the world, and what I found most gratifying in the last two summits was the ability of people from different parts of the world to hear each other and to think about what we can learn from each other to move the field along. We will be having discussions about PrEP demonstration projects, about scaling up projects, about projects that are enhancing testing and serostatus awareness. What's unique about this meeting is it's small, but the variety of representations here from different parts of the globe, from members of civil society, clinicians, policymakers, give us the opportunity really to have a dialogue which will allow us to maybe catalyze new thinking and move the field forward. So we want to welcome you and thank you very much for your being here.
Thank you, Jose. Thank you, Ken, and welcome everybody to this third iteration of this summit. I had the pleasure to meet my former premier and the current High Commissioner to London for Canada this morning. He was a person that really opened the door for us to embrace treatment prevention in British Columbia nearly a decade ago. And we were reflecting on how long it took and yet how quickly we have reached this very important point where we are seeing, as Jose indicated, no longer questions about whether this is the right thing to do, but rather how are we going to implement it. I'm delighted to see here the honorable ministers, Michelle, Debbie, and a large number of people who contribute greatly to making this a reality in the ground. And I think that this conference will continue to show us the way in which we need to move forward. The most recently proposed new targets that I'm sure Michelle is going to discuss, and therefore I'm not going to say any further, are revolutionary and indeed represent a great promise for us to control the epidemic within our lifetime. It's an opportunity that we cannot squander, and we look forward to working with all of you to do the best of this opportunity. Have an enjoyable time in London, and we will talk more as the day continues. Thank you.